Our current 5-day COVID-19 test positivity rate is 1.5%, with 23 new cases of the virus being identified as of 9:30 a.m. this morning, bringing the total number of cases to 1,489. We had 2 cases in Interlake Eastern Health Region, 1 case in Northern Health Region, and 20 cases in the Winnipeg Health Region. 283 active cases and 1,190 individuals have recovered from COVID-19. There are 9 people in hospital, and 3 of which are in intensive care. And number of deaths related to COVID-19 remains at 16. Preliminary investigations indicate that the 2 Interlake Eastern cases are close contacts of a known case. The other cases are still under investigation. Our testing numbers yesterday, 1,266, bringing our total to 158,706. As testing sites respond to testing volumes, some sites that were previously open are now closed. Please see the up-to-date list of open testing sites and hours of operation at www.gov.mb.ca/COVID-19 updates testing. Public Health has advised that John Pritchard School has 6 new confirmed cases of COVID-19 that were identified as of this morning. This brings a total number of cases in that school to 7. Public Health has advised that school that the following grades and cohorts should transition to remote learning today. That is the grade 4-5 split, grades 6, 7, and 8, and Henderson Early Learning Center, which is a before and after school program located at this school. All other grades and cohorts can remain at the school for in-class learning. The John Pritchard School community has been notified. Additional cleaning and high-touch areas was completed. And public health investigation will continue to determine the transmission chains of this virus. Any close contacts or connected to the cases have been identified and contacted and advised to self-isolate for 14 days. Others who are at the site do not need to self-isolate, but should self-monitor for symptoms. John Pritchard has moved to restricted or orange on the pandemic response system, given a number of cases and contacts involved. We continue to remind Manitobans of the importance of the fundamentals, staying home when you're ill, even if mildly ill, washing hands frequently, physically distancing at all times, wearing a mask in indoor public places, especially if physical distancing is not practical. As far as testing goes, public health advises only symptomatic individuals go for testing, unless, of course, they've been advised by public health to be tested. And the same thing goes with employers. Please do not send employees for asymptomatic testing, but do have processes in place for your employees to be staying home when ill. And so I can pass it back to the Minister. Thank you.
Thank you, Dr. Roussin. I know there'll be questions regarding John Pritchard School, and I'm sure other questions as well. Just before we start with those, I want to thank the principal of the school and really all of the administrators within our public and independent school system for the work that they have been doing. We knew that there would be, and we've said for weeks now, that we knew that there would be cases in schools. Our schools are part of the community. There are 220,000 or so students within our schools, tens of thousands of teachers and other support staff within the schools. So, of course, we knew that there would be cases within the school system, and we wanted to ensure that there could be quick response when those cases arose. So yesterday, after cases were identified, there was quick communication with the principal and other leaders within the school who were able to communicate quickly with the parents and guardians who had children who were affected, and then the larger school community as well. That work went on well into the evening yesterday, as well as cleaning of the school, which I think began then yesterday as well, to prepare to be open today. And really, these administrators and others in the school system who are responding when they hear about cases are taking on another level of responsibility that is outside of clearly of their normal or expected work as an educator. And we really appreciate that effort that they're undertaking, and we want to thank them for that. So with that, I'm sure that you'll have questions, and we'll open it up to those questions.
What can you tell us about the John Pritchard School? Is there evidence of transmission within the school? One might jump to that conclusion given the fact that we have this cluster that suddenly erupted.
Right, so within the cohort, we have seen the multiple cases, so we're still doing their investigation, but we still are, considering this transmission within the school, and that's why we had advised those cohorts to self-isolate.
And unless I'm forgetting something, this is the first transmission within a school, correct?
That's right. This is the first that we've been aware of, and so we have a single cohort that was mostly involved. There is a single individual that's outside of that cohort that we're unable to link to that cohort, so it sure could be unrelated, but that's why there's more than one cohort involved in the self-isolation.
Are these all students that have tested positive at the school, or are there any staff or teachers mixed in?
We're not specifically identifying any of them at this time.
Is this kind of sooner than you'd anticipated that we would be sending classes home? Obviously, this is week 2 of the school year. It's not yet winter. People aren't all cooped up inside.
Yeah, well, I mean, we saw cases in all these age groups before we were back in school. So we did expect to see it when we did go back, but we just had the safeguards in place that if we did see it, we would be able to minimize the transmission and minimize the impact on that specific school and the whole school system.
Were they people tested positive showing symptoms at school?
No, none of these cases were symptomatic while at school.
Were they wearing masks and practicing physical distance?
From the reports, masks were in use. I believe in the classroom they had the 1 meter physical distancing.
Any of these cases involve support staff at John Pritchard?
We're not commenting specifically about the nature of the cases.
Do we know the total number, Minister Friesen? Forgive me, Goertzen. It's been a day. Wow. Forgive me. Do we know the total number of students now that are remote learning at that school?
Yeah, so I think that there's about 250 or so who would be remote learning. That might go up a little bit. So that speaks to the fact that the different school divisions back in June were asked to prepare, of course, for a number of different scenarios, and one of them was remote learning. And so they were able to start that process today. Teachers would be connecting with the students, ensuring that there is an at-home learning environment that's very different than what we had in March. And that preparation that took place in the summer is now being activated today.
Parents have to turn on the dime, of course, when this happens, and it's better than having the kids continue to go to the school where the transmission is possible. But what advice do you have for parents who got notified at 9 p.m. last night that, oh, tomorrow your kids aren't going to school?
I mean, it's very much the same advice, that we've been talking about in June, that this is going to be a different school year, and whether that's keeping your son or daughter at home because they're demonstrating symptoms where you might otherwise have sent them to school, or this kind of a scenario where it happens quickly. We are living in a pandemic, and so things are going to be different. I think as of this morning, there was about 450 at least cases identified in schools across Canada. There's 11 in Manitoba, so clearly this is something that every province, every school division, and virtually every school is dealing with in some way or the other.
What do you make of the developments in Quebec? A little bit in Ontario we're seeing too, but the provinces where school started earlier, we already have Premier Legault musing about potentially making all schools go to remote learning because of the flare-ups that they've had.
Well, I think it speaks to the challenge, and clearly we knew that there would be cases that would come into schools because there are cases within the community. We believe that the plan that's been developed together with public health, particularly having cohorts, allows us to continue to have schools operating even when cases are identified. And that's clearly what we heard from Manitobans, that they wanted to have in-class learning. We know that that's the best place for students to be able to learn. So the fact that there are cases is not surprising. The ability for public health to respond to those cases and to provide notification and clear direction to parents and to guardians is really what the system was designed to do.
Dr. Roussin, do you have any sense of the number of people who are self-isolating as a result of those cases at John Pritchard School? Obviously 7 people positive there, but maybe household family members who might be considered close contacts. Any idea the scale of that?
No, I don't have a number on that. So a lot of these were reported, yesterday evening, and so we're still investigating a lot of those things. Yeah.
Dr. Roussin, go ahead, Carol.
Dr. Roussin, initially the press release talked about John Pritchard School, everyone's wearing masks, the risk is low. Do you think that that was underestimated or that you lowballed the level of risk involved here?
Well, it's something that once we continue our investigation, we're going to look to that, look at those transmission chains. It's too early to say whether the first diagnosed case was actually the index case or not. So there's a few things that we have to look at. But like anything in this pandemic, we're going to review, we're going to learn if needed, and apply what we learn.
Based on your investigation, how do you believe the virus got into the school? Community transmission, known? Do you have any idea about the transmission chain?
Well, yeah, we're still looking at that. They're going to try to connect it. We'll certainly do outbreak investigations on this to try to see what we can learn from it. So I don't have a definitive answer on that.
Are these? I know you won't say how many are students and how many are staff, but are they from one family primarily, or they're related, or on the same sports team? Is there any connections you can tell us about?
Well, not specifically at this point. So a lot of this is still early in our investigation, but we do know that there is a one cohort that was predominantly affected, and then a single case that's outside of that cohort, which may or may not be connected to that cohort.
So when you say cohort, you are confirming that we are talking about at least some students here, of course.
Yes, yeah. I mean, I think the cases, there are some students, there's some staff involved. But we don't want to, specifically, identify any of that.
Is a cohort more than a classroom?
Not a single cohort is not more than a classroom.
Minister Goertzen, we were hearing a lot from parents about no matter what the schools do, they're seeing people out on breaks at lunchtime, at convenience stores, gathered closely and mingling. Is there anything that the school or the province can do to prevent that from happening? I don't know if you can lock kids up at lunchtime and, shackle them to, away from each other. I don't know, what can you do?
So I can assure you that shackling is not being considered. But clearly, there are challenges, right? When you're dealing with young people, that's always been true, regardless of what the situation has been. We've all been young at one point and understand that. I hear different things, and some of it is difficult because it's anecdotal, right? And so I've also heard many very good reports about different schools who are having good experiences. I've heard from a teacher this morning again who talked about how adaptable her students have been within her class, and how willing they are and really desirous they are of following the rules. I hear from my own son about the interactions that he's having in school, and how people are trying to follow the guidelines and the guidance, the fundamentals from public health. But I also know that it's not going to be perfect. But that's not just true within the school system. I think that that's true within society generally, where you have different levels of compliance and different levels of acceptance of some of the things that are being talked about. But I don't know And I wouldn't be able to identify specifically that that prevalence is greater within the school system than it is more broadly. But we'll continue, of course, to emphasize and to work with school divisions and schools to see where there are problems and where there are, systemic problems, how to address those.
At what point does your government reassess the back-to-school plan if you are having to have students learn remotely on a very regular basis? What would kind of cause that to happen, where you say maybe we will think about a more permanent switch to remote learning?
So when it comes to remote learning, remember that, back in June, plans were started to be put in place, particularly for those divisions that didn't have a lot of plans by that point in terms of remote learning. So this is a demonstration that their remote learning plans are in place and they can move to remote learning. The province has been working then with divisions now that they have those plans in place to say what kind of overarching framework can there be for remote learning generally, because that's never been off the table. And so that's a possibility if the scenario changes in Manitoba. But also we're doing that because, in the future, we think we need to have a more robust learning capability in Manitoba. So it's also looking beyond the pandemic, but certainly in the context of where we are now, that work is happening with the divisions because they have been able to institute their own individual plans, as is demonstrated today with John Pritchard. But this is this is clearly a recognition that there were going to be cases in schools. Of course, we all would hope there would be no cases, but that's not realistic in a pandemic. The 400 or more than 450 cases that exist in Canada right now in schools or have come from schools is a demonstration that every province is going to have these challenges, and it's about how do you respond to those challenges. And so today's evidence that response happened quickly last night to notify parents and then to be able to continue to have learning for those students who now won't be in their normal classroom.
Mr. Goertzen, what would you say if parents or teachers or others would say, look, the province had a lot of time to plan for this, and why couldn't more have been done, not with remote learning or the bigger classrooms or whatnot? I'm sure you're hearing some of that privately from people as well. What do you say to that criticism?
Well, I think we hear that across Canada, that these challenges exist in every province. And there are provinces that have different plans and some variation of those plans. Even provinces that have had more reliance on remote learning are having significant challenges with that because it's increasing, in some cases, their class sizes within the schools as they're redistributing the workload. And so that's causing more risk within the school setting. So there isn't a perfect plan in a pandemic. There isn't a zero risk plan in a pandemic, but there are plans that can mitigate that risk, that can deal with situations when they happen. And so I would say that, yes, those more than 450 cases that we've seen across Canada are a demonstration that every province will have challenges, but the response to those challenges is what we're really honed in on right now.
Dr. Roussin, you touched on testing sites in your opening statement. We heard yesterday that there were a number of people who were symptomatic who were turned away from testing sites due to capacity limits. Looking at the numbers for testing yesterday, there weren't a whole ton of tests done. I think it was 1,200 or so. What is your response to that, kind of that people are getting turned away and we're not actually doing that many tests yesterday?
Well, I mean, it depends on, one is on the location, right? So each location comprises just a small proportion of the total, so that could be relevant to it. There's, depending on what time of day it is, that those tests will be added to today's account with it. But in saying that, we know that come fall, come respiratory virus season, we're going to need to be able to increase our capacity for testing, and each region's working on that right now.
But right now, we have, like this morning, there were 40 people lined up at Pembina this morning. We've seen ratcheting up, having more. I mean, let's be clear. We're talking about the sampling sites, not the lab testing. Lab testing capacity is fine right now, right?
Correct.
Okay, so the sampling sites, if they're in the past, and especially in April and in May, you were able to rapidly expand that as per needed. Are we going to be seeing more of those in Winnipeg soon?
We are working on an overall testing strategy, right? So that involves sample collection sites, the lab, the reporting, and so we really are working on every aspect of that to ensure we can ramp up the volume of testing and work on our turnaround time.
We're clearly seeing more people, though, go for testing as school begins. Are you prepared to ramp up collection site capacity right now?
That's what's being worked on right now at the regional level. I think that there's a lot of focus on being able to meet that increasing demand, and we see that demand fluctuates over time. So it does sometimes pose a challenge, but we'll we know we need to be able to meet that demand.
In April, when that was happening, yourself and Ms. Saragusta would say, okay, it's going to be tomorrow, it's going to be Tuesday. Are we going to see more by the end of the week in Winnipeg?
I can't commit to that. Remember, in April, a lot of things were shut down. A lot of the healthcare system was had people not doing their normal work. So ramping up sites, shifting people from other areas of work was very easy at that time. It's not so simple at this time.
So, forgive me for this, but what's the point of having 2,800 test processing capacity a day between CADM and Dynacare if we can't actually collect those samples a day?
Yeah, and you could see that we've reached sample sizes much greater than this even in the recent past. So we have that capacity, but we're working on more.
Okay, Doctor, we'll go to the phone for reporters from the Winnipeg Sun. Scott.
Hi, Scott Buck here, Winnipeg Sun. I guess first question for the education minister. It looks like last night 2 emails were sent out to parents, one that suggested 4 new cases, one that suggested 5 new cases. In some instances, parents are saying that they got one email for one of their children and another email for their other child. What was going on there? Why was there a perceived miscommunication with these emails that were sent out?
Thanks, Scott. I believe that they were actually updating the letter in real time. So as they got a new positive test result, they were providing the most accurate information as quickly as they could.
Okay, thank you. And my second question and follow-up question for Dr. Roussin. You've been steadfast in the message of practicing fundamentals, keeping physical distancing, and that it's obviously that you can't keep the 2 meters in school. I mean,
meter separation, seated, facing forward, does provide a level of protection. I think that the further distance you are from someone, the less risk is involved. So it's all a gradient. But like we said with our response to our plans there in education, it's a multi-layered approach. It's ensuring symptomatic people aren't beginning at school, hand hygiene, disinfection, some form of distancing, and cohorting. So it's a multi-layered approach.
From CBC Radio Canada, Gavin.
Hi there, Dr. Roussin. I was wondering if you could just provide us some more information about the case in northern Manitoba today. It says that they're on the provincial website here. I'm looking at the map, and it says there's 2 active cases in the area of Shamattawa, York Factory, Petaskwayak, and Split Lake. I was wondering if you could comment on that.
Yeah, and so the one case that's reported today in that region, the preliminary information I have is it's a person who's actually living in the Winnipeg region, and so it's not actually going to be an active case in there, and we'll be updating that. But that's preliminary information right now.
Minister, for you, I'm just wondering, we're hearing about difficulties concerning remote learning about having trouble hiring staff. Certain divisions are still having trouble getting it underway. I'm just wondering whether you think it was wise to start the school year with learning in class before this remote learning system was really completely set up.
So I think I'd need to hear more specifics about the challenges that you're hearing. I know that department officials are in contact with the different school divisions every day, and those challenges that they might have are identified and are worked through. So I don't have the specifics that you might be referring to. I do think that there has been excellent work happening through the summer to ensure that there are remote learning opportunities available when students need to self-isolate, as now is the case as we're seeing with John Pritchard, or where they're immune compromised, and where there are challenges, like there often are in the school year. Let's remember now that with 220,000 students, the beginning of a school year never goes entirely smoothly. There are often challenges that have to be worked through, more this year than most, obviously. But those are being worked through with department officials.
From CTV, Jeff.
Oh, hi, Dr. Roussin. This question's for you, Jeff, from CTV. I'd like if you could just clarify the answer you gave to Steve. My apologies. I have trouble hearing all the questions on the phone. Is it the belief that these cases are transmission within the school? I just want to be clear on that.
Well, I think when we saw this number of cases, many of them within the same cohort, we certainly don't have the complete investigation right now, but we had to act as if there was transmission within that cohort, and that's why we've had them all self-isolate. So our investigation's still pending, but I think when you see that many cases within a cohort, that would be our default that we would start with.
Thank you for that. And my other question is, now that the school is in orange, for people, for parents, students, anybody going to that school, can you remind us what restrictions are now in place?
Mm-hmm. Right, and so for this this particular school, because it was a K-8 school, the real restrictions are now that the remaining cohorts are still attending school as before. There is now that 2-meter physical distancing requirement in for the rest. If we had a school that, say, had 9 to 12, once a school went to orange, then 9 to 12 would be being done remotely, but that doesn't affect this school.
From City News, Mike.
Hi, this is Mike Albanese, City News. This question is for either Dr. Roussin or Minister Goertzen. I know we say we're not surprised that there are cases already, but are you surprised that there's already 7 cases in 7 school days? Should we be prepared for about this ratio of cases per day, or is this higher or lower than you anticipated?
So thanks for the question, Mike. I don't think that we sort of charted out expectations in terms of when cases might come. I suspect, like we've seen with the pandemic generally, there'll be ebbs and flows for a variety of different reasons at a variety of different times. What we did was to prepare for cases and ensure that we could respond quickly and appropriately when those cases inevitably came up. When you look across Canada, there's more than 450 cases. I think there's 11 in Manitoba. So clearly what we're facing in Manitoba is not unusual to what's happening in Canada. We just need to make sure that our response is appropriate to give parents that assurance that they're going to get the information they need, and I think yesterday was a demonstration of that.
No follow-up.
From the Brandon Sun, Emily.
Hi there. My question is for Dr. Roussin, and I'm just wondering, do people from the same household as the students in the that affected cohort at John Pritchard School, do those household members also have to isolate for 2 weeks because they're close contacts with the people that were in that class?
Right, yeah, and so typically a contact of a contact is not considered a contact. So if there is a case, certainly one of these cases at home, it's going to be very likely that all of their household contacts will be contacts, and they'll be required to self-isolate for 14 days. Someone who is a contact to a case, the people around them aren't considered contacts. So, but when you're self-isolating, you shouldn't be really in contact with others. So it should be have plans in place to really limit any close, prolonged contact with other people in that house. Certainly, if that person develops symptoms, then that household would become a contact.
Okay. Yeah. So just to clarify, the only people that are required to self-isolate are the confirmed cases from that cohort and the other students within that staff and students within that cohort.
That's correct. Yeah, and it's when we're talking about being contacts or a case of COVID, the only people really required to self-isolate are those who public health has specifically advised to self-isolate as well. So so that's another layer on top of that.
Thank you.
From CHVN, Taylor.
Hi, good afternoon. This is Taylor. At what point does the province decide to send students or cohorts home for remote learning?
So thank you, Taylor, for the question. Of course, when there's notification that students have to go home because they have been advised by public health to self-isolate, that automatically then results in remote learning being activated by the school divisions. They've been doing that planning since June to make it a better experience and obviously what they would have expected in March when there wasn't that time to prepare. So that is happening now with the John Pritchard students who are impacted and others who within that school who are would be choosing to have remote learning. So it's triggered by public health and their notification.
Now, a lot of parents are looking at what's going on right now from the outside, wondering about their own children and how they can talk about this. How can parents talk to their kids about the pandemic and staying safe in schools, but not creating fear at the same time?
Yeah, that's an excellent question, and I think all of us as parents, have struggled with that a little bit in terms of where is too much information too much, and it somewhat depends on the age of the child, right? So it's somewhat dependent on the age of your individual child, but certainly I think that parents should be expressing to their students that they should be following the guidance that they are getting within the schools. Goes back to an earlier question that those provisions, while they might not always make sense to a student depending on what age they are from a medical perspective, but they're there to protect them, and they should follow that guidance. That there are a lot of good people at public health, Dr. Roussin chief among them, who really have their best interests in mind and who are thinking through a lot of different protocols because they want to help and protect them, and to follow that advice that they're getting at their school level from their teachers or their principals.
Thank you, Minister. We now return to the News Conference Theatre.
Technical question, if and maybe I misunderstood, but if there's one cohort involved at John Pritchard, and the cohort is a classroom, and then there's another individual outside that cohort, that sounds like two areas. Why are there 3 grades and then a split class?
Right, and so we have the one cohort. We have a single person outside of that cohort that we can't necessarily link to the specific cohort, and then the other cohorts are somewhat connected to that single case that's outside of there. So it's more of an abundance of caution that we expanded the cohorts that need to self-isolate.
So there's some intermingling. Okay.
So for any further cases that may, for any more people who may be tested positive, who've been sent home among those grades, will public health identify the fact that they were those kids that were sent home?
Yeah, we'll be linking them to this as an outbreak investigation, so we'll be keeping people up to date on the numbers.
Dr. Roussin, how many of the 7 patients at John Pritchard are now symptomatic?
So the information that I have is that all of them were asymptomatic while at school, but all of them developed symptoms and then went for testing.
I see. So they were not all without symptoms when they got tested. So they had symptoms. What breakdown, forgive me, of the 7 were symptomatic when they got tested?
When I, the information that I received, we're just rolling all these numbers up, was that all of them were.
All of them were symptomatic.
Yeah, all of them. None of them were symptomatic at school, but all of them went for testing while they're symptomatic and appropriately isolated while they're symptomatic.
Okay. The first person who got tested, I thought was, forgive my memory here, asymptomatic.
Was asymptomatic, but had went for testing after developing symptoms.
Asymptomatic at school. So everybody at John Pritchard, just so I'm making this idiot proof here, had symptoms, then got tested.
That's right, and that's, again, this is a number of these cases were just reported to public health and then reported to me, so that's information I have.
We're all asymptomatic at school.
That's correct.
Okay. Minister, how many schools other than your sons have you visited since the start?
I will have visited, incidentally, I think 3 schools, not as an official visit, but there are visits that happen incidentally now. You know, we're not asked to be visiting schools. We're supposed to be limiting the number of people who are coming from outside of the school.
So now that it's a code orange at John Pritchard, does that mean that they're going to be moving students from classes that didn't have 2 meters into spaces where the students are now remote learning? Like, is there more room now for people to spread out, or how are they following the 2 meter requirement?
Right, so that's what the opportunity is there, is that now that there's some proportion of students that are self-isolating, they'll be able to meet those the 2 meter requirements because of that added space.
Dr. Roussin, how come we're not updating the pandemic response system online in real time?
Well, like for the school, the one issue is that we decided that the school community and the people who are involved in the cohorts should hear it from us directly first before media or before a website.
Just one follow-up to my question here, and forgive me if this sounds picky, but I understand we are trying to limit the number of people, but in order as minister to see how well the cohorting is working, how well it's working, do you intend to visit schools more to see it firsthand?
Yeah, I think it would be helpful to visit schools. Now remember that it's been, so I have visited 3 schools, but not in an official capacity. It's been about a week, and I think it was appropriate to make sure that people had the opportunity to acquaint themselves with their classes and the protocols, but I do think it would be appropriate, where it's considered safe to do so, of course.
I'm just wondering if the minister shows up unannounced, does that cause administration to, I mean, we've all seen episodes of The Simpsons, right, when the superintendent shows up, right? But I'm just wondering, is there an element of, you don't want to, if you tell them ahead of time there's a Potemkin village, they show up and they do things they might not do. If you don't show up, you can scare the bejesus out of people. So
I'd like to know who you think I am in The Simpsons, right? Like if you're Bart, then who are you asking me to be? Listen, I mean, I might end up visiting the schools unannounced or otherwise, but I do think it would be helpful and appropriate.
Okay, thanks, everyone.
Thanks.
Thank you very much.
What's that?
In The Simpsons, it's Chalmers.
Oh yes.